And we're going to talk to some folks this morning who have been working on this for a while. We have the absolute pleasure of having some folks from the Department of Behavioral Health. I can't get the whole name right. I'll let Sheamekah do that. We have folks from Medicaid. Now, guys, I know a lot of you have had bad Medicaid experiences, but those were not with Traylor. Okay, he's going to tell you the way it should be done. And then we have two of our wonderful family-run organization executive directors with us. And they're going to talk to us about how Oklahoma has soared to the top in children's mental health services. This is considered one of the best states in the nation. Now, we should have had some realtors here so they could have talked to people about moving when you're finished. But please, just listen, absorb what they tell you. We will have time for questions at the end. So please, if you have questions for these folks, be writing them down. And we'll get to those as we can when we're finished here. Thank you guys all for getting up early and being here with us this morning. And I'm going to let our panel introduce itself.
All right, good morning. So excited to be here. I'm Traylor Rains. I'm the State Medicaid Director at the Oklahoma Healthcare Authority.
Good morning. I'm Sheamekah Williams. I'm the Director of Children, Youth, and Family Services for the Department of Mental Health and Substance Abuse Services.
Good morning. I'm Joni Bruce. I'm the Executive Director of Oklahoma Family Network.
Hi, I'm Becky O'Dell, Executive Director for Parents Helping Parents.
Now, first question for you guys. Can you hear them? No. Okay. Can we get this mic'd better? We got important information coming out here. Okay, what each of you just say your name again. Let's see if they've got it.
Traylor Rains.
Sheamekah Williams.
Joni Bruce.
Becky O'Dell.
Seeing thumbs up.
Okay, people in the corners, can you hear? Okay, all right. Okay, so let's get started now that we've got our technical things under control. I'm going to start out just asking these folks some very general questions, and then we will get a little more specific as we go. There's no order to how I'm going to ask these questions, and they're equally important. So, don't think, oh, Lynda's got a plan. Lynda never has a plan. So this is just really me trying to get some information for you guys about how the system works. But I am to start with Traylor because he is our Medicaid person. And as we know, Medicaid rules the world. Now, somehow, Medicaid has given up some of that power here, and they've distributed it to some other folks. Why, Traylor? Why did you do that?
So I think what makes Oklahoma so great is our ability to cooperate among our sister agencies and our stakeholders and our community partners. It's been about 10 years ago. It was 2012 when the decision was made at the state level to give the state appropriated dollars for the Medicaid Behavioral Health Program to the Department of Mental Health and Substance Abuse Services. The reason for that is we really recognize our Department of Mental Health and Substance Abuse Services as the expert in the field of mental health and substance abuse services. It's in their name even. So we, instead of recreating the wheel as we always had done and having an internal behavioral health department that focused on prior authorization, we knew that they had strengths and community and stakeholders with their community mental health centers and just all their expertise. We've done that not with mental health, but also with the Department of Human Services, who operate some of our waiver programs. Again, they have expertise in that operations aspect. But it's really just working across state sister agency lines, which it's become old hat to us, and it's just normal. But when I go to national conferences, and people could even be in the same building and they don't talk to each other. And so I'm excited that we're so unique in that we've made so many strides.
So you guys actually work together.
We do, yeah.
Okay, show of hands. Do your Medicaid and behavioral health departments work together? Yes, hands are up.
Wow.
Okay, so maybe this is a unique concept. Let's learn more. Sheamekah, is this really working? I hear Traylor saying it's working. Do you think it's really working?
I do. I think that being the behavioral health agency, we can't be the expert in everything, such as different Medicaid policies, different things that impact us as a state through our state plans. And I think that it takes a village to raise a child. I think
Amen.
that village has to be at different levels of the system. And so partnering with our Medicaid agency and Department of Human Services and Office of Juvenile Affairs and other child serving agencies in order for us to design and develop the best system for children, youth, and families in the state of Oklahoma is important.
Okay, now I heard you say children, youth, and families.
Yes, ma'am.
Okay, let's check in. Families, do we agree? What do you think, Joni?
Well, it's really important that we all work together. And interestingly enough, both of the agencies that are represented here today have family voice integrated into all that they do. Sheamekah has the state advisory team for systems of care at the state level, and there are family members always that are a part of that team. And then at the Oklahoma Healthcare Authority, our Medicaid agency, they've had a contract since 2012, and they have a family and patient advisory council that provides input into their policy and the way that they run the organization. So it's good, it's important. And then from my perspective, it's very important that they have a good relationship. And really even our Department of Health works beautifully with them, as well as Department of Human Services. And that's important, because if we don't all work together, we won't have the best services for families.
Becky, would you agree with Joni? Do you feel like your voice is heard?
I do. You know, for a long time, we kind of felt like our voice wasn't, but we're with the, you know, the Department of Mental Health and Substance Use or Substance Abuse Services has been really great to us and allowed us to grow and are open to anything that we might want to try or suggest. And I just can't imagine that we would be here if we didn't have their support. I could say I need a meeting with, can I have a meeting with 5 people from the department? It happens. It happens. So, yes, absolutely.
So I'm hearing family voice at the table, family access to people who are in decision-making positions. How about you guys? Is that happening in your state? Show of hands. A few, a little better, a little better. Okay, so this is where we definitely want to spend some time, but you guys are, as I understand, moving towards managed care.
Yes.
Now that has been done well some places, and other places we're struggling. Well, what makes you think yours will be different?
Well, Oklahoma is special. We do things a little differently. Also, I will say that there's something to be said about being one of the last in the nation to roll out a managed care program. We have the benefit of learning from the successes and the failures of other states. I will also say that we got about 70% of the way to implementing managed care last year, and there was some things with the Supreme Court saying we didn't have authority, and so we paused. But there was also great experience came with that, what we're calling our dress rehearsal. So we listened to the providers, the families, our members last year. I felt like we had a great product moving forward then, but it's even better this year. We've done, our philosophy is to engage the public as much as we can. So we've done a series of stakeholder town halls before even releasing the request for proposal. We'll do another round of the ones we've awarded those. But it's important that to us that we listen to our members, our providers, making sure there's going to be as least abrasion as possible as we roll this out. And really the motivation for doing this is first and foremost our members. I know that our providers and some of the stakeholders can see it as it's another administrative burden. It's just going to make it so much harder. We're so used to the good work that the Healthcare Authority does now, the quick turnaround times on PAs and things like that. But there's so much more value-added services that a managed care entity can bring to the table that we just can't reimburse for as a fee-for-service Medicaid agency. Those things that really impact social determinants of health, those things that impact our daily lives that end up having an impact on our overall physical health that we can't pay for, but a managed care plan could. And so we're really being intentional about how we craft that contract with them as we solicit bids to make sure that that is first and foremost and really improving the quality and outcomes of those 1.2 million individuals that we serve.
Wonderful. Sheamekah, did you feel like you had a voice from your agency in this planning for managed care?
Absolutely. I think that it was unfortunately last year, the managed care didn't move forward into the process, but early on, Department of Mental Health was involved in the design and the development of the RFP. The communication that actually went out across the state, we were there. And in a lot of the reviews, we were also involved. There was also a piece where there's some special carve out for behavioral health. So we were able to be a part of guiding and providing direction to that. And I think one of the most important pieces that Traylor mentioned, this process did not take place without not just the citizens of Oklahoma, but specifically the parents and caregivers of Oklahoma having the ability to provide feedback and information as it relates to managed care.
That's great. That's wonderful to hear. I'm gonna switch it up down here a little bit. Becky. Yes. How do you think they're doing on rolling this out? What makes you nervous about managed care?
Well, since we don't do direct service, we work with those parents that we're very happy, but we haven't been actively involved in the managed care side of it. But you know what you hear and eat, something just like that. It's going on. We just, you know, we really care.
Oh, we need to speak up. We need to speak up. Thank you. Thank you. Joni, what do you think?
Well, I think that, we've kind of been down this dog and pony show a few times. How many times have we tried to go with managed care? 3 or 4 times. And each time there have been focus groups all across the state. There's been access for families to share their stories and their concerns all along that way. And I think we're still concerned because we know what to expect from our Department of Mental Health and Substance Abuse Services, and we know what to expect from the Oklahoma Healthcare Authority. We know how to call the helpline.
Right.
We know how to access people on the inside if people are having a hard time getting things done. So I think there's some fear among families and individuals in our state, but it was decided and we're moving forward, and we just felt like as long as families who had a wide range of experiences, a wide range of ethnicities, as well as, where they live, what happens in frontier Oklahoma is very different than what happens in a metropolitan area, just because services aren't as available in rural areas. And so we all had opportunities to engage with some of not only with the Healthcare Authority and the department, but also we had opportunity to engage with different insurance companies that were actually writing the RFPs for managed care. And a number of them have come back to us several times and asked for focus groups, or at least to talk with some of our family leaders so that they could give input of, they ask questions like, what's the most important thing? What's missing now? When we talked about how hard transportation is, they wanted to hear what part of transportation is hard from getting your healthcare needs met. So, I'm very hopeful because, as Traylor said, sometimes managed care organizations or accountable care organizations have more flexibility than the Oklahoma Healthcare Authority. And one of the things that's good is because many of the family groups have engaged with the different organizations that are writing the RFPs, we'll hold them accountable. If they don't do what they said, then we're going to be there to advocate and help families advocate for the needs of the individuals that are being served.
And we were, if I could add too, we were very intentional in crafting our request for proposals that any bidders that are successful have family voice at their tables as well. So not just our member advisory task force at the Healthcare Authority level, but also in each one of these plans will also have families at the table driving their decisions as well.
That's wonderful to hear. How many of you are working in are a part of a managed care system? Not working, but your services are coming through a managed care system. Are we in the managed care business yet in most of your states? A few? Okay, so these are nuggets of information you can take back to your state as they're planning. I do have a question about this, and I've asked this in several states. A lot of the folks you see in this audience are families who are supporting children who are dealing with both behavioral health and substance use challenges. How will your managed care system, like, will these moms have to go to 3 different places to get services? Are we getting even close to having a system that doesn't have silos?
We're trying. And so that's kind of one of the main driving forces behind moving to this model is the care coordination aspect that comes along with the managed care entity. Right now, the healthcare authority only has resources to staff nurses and behavioral health professionals to a level of really managing those with acute, chronic addiction issues or mental health issues or even medical issues. So we're talking about like high-risk pregnancy or those with sickle cell anemia that need just a high level of care coordination. That's where we have the resources to focus. With a managed care entity, everyone coming into a plan will go through a level of health risk screening. And so they can quickly identify, okay, are there any needs maybe that we need to coordinate quickly and get them the right service at the right time. And so all the members will be assigned a care coordinator who will then work with the community providers, will interface, of course, with our current systems. We've done really good so far with our 988 system, and there's plans for integration between the managed care entities and all that. So where we can get away from duplicating efforts, we are. So I feel like we get closer and closer to those fewer and fewer silos.
Right.
Yeah, Lynda, and I think that there are some benefits to managed care in the coordinating services for children, youth, and families who are struggling with co-occurring issues like mental health and addiction. I think, but also to really take a step back, I think the state has really been preparing in regards to parity as it relates to mental health and substance abuse treatment. That we have really leveraged a great platform providing training and expertise to providers across the state. In addition to that, really looking at avenues that really help to increase expertise around evidence-based practices and best practice models to provide the best possible treatment. I think Becky mentioned it earlier. It's really important to us as a department that not only are we inclusive of the young people who are struggling with addiction, but we're also inclusive of the caregivers and the parents. And so through our different partnerships with our family org, really understanding the needs of families in the state of Oklahoma was extremely important to us as we begin to make sure we design out a much, much better, robust system. Are we there yet? No, but we continue to move in that direction.
That's awesome. And we also know that we've got silos with our mental health and our IDD populations that we want to work with over time, knowing you can't fix everything today. But Joni and Becky, I would ask you guys, what's some advice that you would give your state leaders about how to work on these silo issues from the family perspective?
I would say, although our folks are really good, but I would say just listen. I would say just listen to the families and work with us and bring us in on some of the planning that we can help with. And they really do a good job of that. That's what I would tell them, is keep the families involved.
For me, I would say. Okay, hello? Maybe that's better. I think what I would say is kind of mimic what Becky said, just engaging us a little bit earlier. One of the things I love about working with Sheamekah is she'll call me and say, hey, I'm writing this grant. Would you be willing to do X, Y, Z? And, I was speaking with one of our other advocates, Jeff Talent, over the last few weeks. And we're like, we just need to step it up one step earlier so that before the grants get written, that we all work together and kind of think about how can we use the strengths of the Department of Parents Helping Parents, of Oklahoma Family Network, of Evolution Foundation, of our community partners, because I think that would even strengthen our grants even more. But it's hard to complain. They support us, yeah. They support us a great deal. And, Sheamekah has staff that engage with us on a very regular basis. Like Becky said, if we have ideas to do regional institutes, to support families and youth out in the communities, they're always willing to listen and help support that work. But I think maybe just getting involved just a tiny bit earlier, just to give ideas so that as those grants are written, maybe you see that family influence a little bit earlier. Hard to complain.
That's the age-old problem with grants.
Yeah.
They're so
They come in
fast.
so fast.
Now, you guys saw, my voice is about gone. I'm so sorry. You guys saw when I asked about how this is working other places, the atmosphere is not quite as positive as it is up here. So what would you say to these guys? Traylor, in your position, I mean, you're in a powerful position. You should make both. You are scary people to families, whether you mean, I know you don't mean to be, but you are. How do they access your counterparts in their states? How do families get to you guys?
So I would say it feels like we're a veil that can't be pierced sometimes, and I get that, but I rarely turn down a meeting. I think that folks don't realize the level of, if you call your legislator, I will take all those meetings. If you call me as a family advocate, I will take that meeting. I meet, that's primarily what my job is meeting with stakeholders and engaging. Reach out. I don't want to make it seem like this was a collaboration or a relationship that happened overnight. We've been doing this a long time. I was at the Healthcare Authority when we created the Member Advisory Task Force. I've worked with Joni for over 10, 12 years. And a lot of it is due to the advocacy of organizations like Joni's, of just continuing to come back to the table and call us and put things on, kind of at the top of our list. And I would say, don't be afraid to call. Don't be afraid to reach out. We're there. Most agencies will have someone to meet with you and get it elevated. We're at a point now where it seems natural to have family voice at the table, but that's just because
That's wonderful to hear.
well, we have really good advocates in the state. I will say too that Joni is actually on our medical advisory council. So the all Medicaid agencies are typically governed by a board, and they're federally required to have a medical advisory council. We have a family at our table on that. So I would encourage you to go back to your states and talk to your Medicaid folks about something like that. Yeah, I would say just reach out. And if all else fails, I don't love that avenue, call your legislator.
That definitely works.
I also think, Lynda, that I think there's also the availability of leveraging when you connect with the family org. I can't, as a state employee, I'm a director for children's services, but I'm also a parent. And so oftentimes as a parent, there are things that are happening in our state and I need someone to leverage my voice. So connecting to a family org is a way to do that. I agree with Traylor. I think that as taxpaying citizens, we should have the ability to contact our governor's office, our local legislators, but then also our state directors. I'm very much like Traylor. I don't turn down a meeting. I talk to parents all over the state of Oklahoma, trying to aid and support the things that they're in need of. And so I would have to say is that, here in the state of Oklahoma, we hear you. We try our best to hear what's happening with our families and our young people. But then also we have avenues to connect with organizations that help us to identify things that may be happening that we may not be aware of.
And then I would just add, if I can, Lynda, then we as advocates, when you go and meet with your Medicaid director or with your children's behavioral health director or whoever that might be, don't just go with complaints. Go prepared. Think about what would specifically make this issue better. Just to give an example, a lot of families in Oklahoma 5 years ago, we were noticing that there was a high incidence of emergency room visits. And the Oklahoma Healthcare Authority was trying to figure out what that was. Some of it was behavioral health. Some of it was just physical health issues. And they were trying to figure out, why is this going on? We also had a fairly high no-show rate where families weren't showing up for their kids' appointments. And they're trying to figure out what is going on here. And so they actually started calling and finding out, what's the reason behind this? And transportation was a primary issue. And the Member Advisory Task Force, which is the Patient and Family Advisory Council for our Medicaid agency, over and over again since it started, they've talked about how difficult it is if you have a sick child or if a pregnant woman is ill. It's hard for them to make appointments because they have children at home and they couldn't take the children along with them in the car. And if it was a sick appointment, sometimes you don't have a whole lot of notice. You might go in a portal and make an appointment during the night, but then you can't find anyone to keep your other children. And so the healthcare authority went back and they said they went to their contractor who managed their transportation contract for members of Sooner Care, which is our Medicaid. And they actually realized that a number of the vehicles that were taking individuals to sick visits, whether it was a pregnant mom or a child, there were usually empty seats in the car. And so they actually, that contractor stepped up and said, we'll allow up to 3 children in the car if it is for a sick visit. And that changed huge for families. It made a difference of being able to go in and get care at an appropriate time, which may keep you from going to the ER because the only time you might have had a ride was after work when someone was off work. And you don't get good health care, not behavioral health or general health care, by going to the ER all the time. So that was a time when the members shared their concerns. The agency knew there was a genuine issue, and by working together, they were able to meet the needs of Oklahoma families better. So don't just come with the complaint, but come with, is there not a way that we can fix this? Because I think that your agencies will be a lot more open to visit with you if you come with a plan of a possible way to do it. And then you just have to be flexible, because sometimes Medicaid won't allow for certain things. And so their hands are tied, but it doesn't happen overnight. These relationships have been built over years, but don't give up. Just keep going back. If you have families that are not being served well, go to that Medicaid director, go to your children's behavioral health director or your adult behavioral health director and tell them, here's the concerns that these families have. And here's an idea of how it might get better. And then they'll begin to respect you because they realize you're not just there to complain, you're there with potential solutions as well. And that helps to build those partnerships more strong.
And we've, I'm kind of skipping away from that. We've loved the emphasis on rural communities. I mean, we all know in the cities we work really hard, but rural Oklahoma has been a real concern. Or their work, we're all working on rural Oklahoma and appreciate that so much. And I'm not going to let you go anymore until you tell them what happened in Colorado, and that'll tell you how well it's going.
Thank you, Becky. So I say, again, I stand on the back of giants. So this week, I received the National Association for Rural Mental Health Award in Boulder, Colorado. But I say that. I say that as a tribute to the work that is happening.
That's amazing, Sheamekah, and you are well deserving. So guys, a couple of things that I've heard up here that I want to make sure you hear, and I know you can hear me. First of all, we all have a responsibility in this, right? We're in this together. This is a partnership. And if you can't get in touch with your state people, you can get in touch with someone in your legislative offices. And I can tell you, I used to work for the state of North Carolina, and the fastest people moved in the state of North Carolina in the Albemarle building was when we got a call from a legislator. It was like magic. It shot down the hall to the right person, and you were taking care of it in the next 5 minutes. So that will work if you have to do that. But if you've never tried, I mean, look at these. These are nice people. Would you like to talk to them? If you haven't tried calling your Medicaid folks, your folks in your behavioral health, please do. And as Joni and Becky are saying, go in with a specific ask. Don't just go in to say, well, I wish things were different, because they may honestly not know how to make them different right now. Give them some specific asks. So those are some things we're picking up from right here. Now, I'm going to change the conversation a little bit. We've talked a lot about families. I want to know how you guys are getting input from your young people. These folks who are actually getting the services. How do you get their input?
I will say from a Medicaid standpoint, we could probably be better in that respect. We do rely on our families and caregivers a lot of times to kind of let us know what's going on with the services for youth and adolescents specifically. We see things through patterns of utilization and we know what's going on, but we could be better. I know that DMH is probably doing a much better job in that space than we are. I'll admit that.
Yeah, I would have to agree with that one, Trey. So the Department of Mental Health, we have a youth advisory committee, which is a state level advisory committee of young people all over the state. They come together to really help us look at specific issues as it relates to youth. They come to us to provide us.
Having a hard time hearing.
They come to us, they support us in not only identifying everything, the gaps in services, but information that will be helpful in upcoming grants and opportunities, advise us on new maybe policies that may be coming out, and really help us to get a fundamental understanding of what's happening on the front lines. And so again, shout out to our youth coordinators at the Department of Mental Health who help to facilitate these great youth from around the state of Oklahoma. And we're always soliciting and trying to get input as to really what's happening at the local level when it comes to our youth. We have an opportunity to do everything from site reviews to review documentation to look at the youth voice that is involved in not only their treatment, but at the different levels of the system. And so again, I would have to say that that is an area that we continue to improve in, but is an area that we have some footing.
Wonderful. Joni and Becky, how do you feel? Are we doing okay with getting our youth voice involved?
I think we are. I would have told you 5 years ago when you asked me that, I would have said, we don't work with you, we work with parents. But being connected to the Department of Health Substance Youth Services. Oh, somebody's gonna yell at me. We do consider young people and where that fits. As a matter of fact, we're getting ready to have a retreat, online retreat in December with panels. And we got to have a youth representative on all the panels. So they really made a difference for us in seeing that there are ways that we can serve those young people and just give them that voice.
I think the other thing that the department's done really well is given access to youth as well as families, but specifically youth at our Children's Behavioral Health Conference each year. They bring in like 100 or more young adults from across the state. And they actually have an opportunity to hear nationally ranked speakers and just have an opportunity to be a big conference like this, go to the booths, hear the different speakers, learn among adults, and then also among their peers, and have opportunities to do fun things, but also to learn and grow their leadership skills with the hopes that they go back to their neighborhoods and share what they've learned with other young adults. And I think that's really important. And Becky mentioned the retreat. We actually kind of run two. We run one. The Children's Behavioral Health Network in Oklahoma is made up of Parents Helping Parents, Oklahoma Family Network, the Evolution Foundation, NAMI Oklahoma. Is that it? And then the Department of Mental Health and Substance Abuse Services. And we worked together for 6 or 8 months and planned that retreat. We've had to do that. We started them during COVID, so all of them have been by Zoom, but we also provide them in Spanish so that the participants can speak English or Spanish. And we provide American Sign Language as well, so that it's as accessible as we can make it. And that's an opportunity for families just to have some downtime. The youth as well. The youth plan their retreat. Family leaders plan the family retreat. And it's just an opportunity to learn coping skills, get to know other families, be engaged, hear speakers that help them access services in school, in the medical arena, the behavioral health arena. And our families really appreciate it. And we all of the Children's Behavioral Health Network partners have contracts with the Department of Mental Health and Substance Abuse Services so that we can actually provide those types of opportunities to families and youth across the state. But we still have a ways to go from a youth voice perspective. We have telling your story trainings. NAMI does as well. NAMI does a great job with Smarts on Advocacy. And I think we're all just trying to focus on that more and give youth more opportunities. We usually have the youth speak at not just the youth retreat or youth conferences, but we also have them speak at the family conferences because it's really good for we as parents to hear from youth how they feel about the way we've parented or the way services look or that type of thing. It's very helpful.
And I would say something else that we do and you do too, is that if we're not able to do something ourselves, we'll partner with one of those youth groups. If you go out and look at this is a sales thing, but if you go out and look at our table out there, you'll see a partnership with the WAVE group where we've set up a display of things related to hiding drugs and things like that. And that's great. So they're getting to the young people. We're providing the items and the printing and things, and it's a wonderful partnership. So that's another way that we do.
Yeah. Lynda, I think there's also two other things that we do that I think are extremely important. One, we sit youth at our advisory board table, our statewide systems of care advisory board. Sometimes we don't always have youth present. Their lives are active daily, but we sit them at the table of professionalism because we believe that their story, their lives, the different things that they've experienced isn't a professional experience to provide us with the foundation and the knowledge that we need to know in order to continue to grow and develop our system. And also, I think that one of the other important things, prior to COVID, we were able to develop our first youth move chapter in the state of Oklahoma. And so as I've been with the state close to 15 years now, we have really been moving in a direction and partnering with Youth Move National in order to do this. So I don't know if Mark is here, but I know he's the executive director of Youth Move. And so again, he will be happy to know that we do have a chapter in the state of Oklahoma.
That's great. That's wonderful. All right, so wonderful partnerships happening in the state. Excuse me. I do want to ask you about your wraparound high fidelity services, because I understand that those services have gone statewide.
Yes.
How's that working? That's a big step.
So Lynda, that's one of those things that I can go on and on and on and on and on. But I'm going to give you the shorter version. I mentioned 15 years ago when I came to the state of Oklahoma, I was fortunate to sit underneath a lady by the name of Jackie Shipp, who had a vision for systems of care here in the state of Oklahoma. And that vision was that children, youth, and families across the state would not only have access to services and supports in their home and their community with hope for tomorrow. Wraparound really was a foundation for us to be able to provide services to youth who were considered to be SED, severely emotionally disturbed. Kids that were on the higher end of the spectrum and at risk for higher levels of care. And so the state moved in the direction of forming a statewide system. We were able to leverage wraparound services in all 77 counties today here in the state of Oklahoma underneath our systems of care umbrella. Again, as COVID and different things have happened, we continue to push to the highest level of fidelity that we can have, because we know when the fidelity is high, families are having better outcomes. And then also we begin to align our wraparound services statewide with our CCDAC initiative. And our wraparound providers are I say they're the lifesavers. Because in our crisis system, when we have kids that are in crisis and we're really trying to stabilize them in the community, in their community, our wraparound providers are the providers that really work continuously in the home, in the community for that stability. And so I am really excited about how we have a strong foundation with systems of care values and principles and wraparound is one of the highest levels of outpatient service that you can receive in the state of Oklahoma.
That's awesome. That is awesome to hear. Family perspective, how's this statewide implementation working?
Well, when you go to one county, you see one county. You know, there's a consistency there because
We can't hear you.
there's, is my mic working? Stand up, speak up. Okay, I'll speak up. You know, there's flexibility in the way each county runs their systems of care program, which can be good because the needs in one county may be very different in another. Now, I don't think my mic is on. Here we go. Each county looks a little bit different. And I would say that some counties are stronger than others, just to be real candid. But because, just for instance, all of the training for family support providers and care coordinators, who from my perspective are a critical part of the team of wraparound, they're all trained by the Department of Mental Health and Substance Abuse Services. Thank you. Okay, is this one working? Yes, seems like it. And so when there's consistency in the way that people are being trained that are providing the services, that's good because you'll come closer to reaching that high fidelity model than if that's not the case. And so I'm very appreciative of that all of the new staff are getting the exact same training regardless of where they live. I think that COVID has changed a lot. And some of it is for the good. You know, before COVID, you didn't have agencies who have iPads that'll take them out to the home of the family so the family doesn't even have to leave and they can receive the services that they need. And maybe the provider is in a metropolitan area, but the youth and their family are actually at home. And there are a lot of youth that actually will open up and they feel better by being served in their own home than they do, you know, having to go somewhere else. And so I would say, you know, is every county 100%? Now, I wouldn't be telling you the truth if that were the case. But I do think that the department really makes great attempt to ensure, just with site visits and with training they provide. I think of all of the agencies that we partner with, the Department of Mental Health and Substance Abuse Services provides more training, not only for their staff and their contractors, but for their sister agencies as well. And in our state, it's been very interesting because trauma-informed care is not just an issue for the Department of Mental Health and Substance Abuse Services or just for the Oklahoma Health Care Authority or Medicaid agency. They have infiltrated every agency in our state. And so Office of Juvenile Affairs, you know, they play a huge role in trauma-informed care, making sure that all of their staff are trained and that they understand that. The Department of Health, you know, their staff go to these same trainings. And what I've seen happen just over the last, I don't know, 5 or 7, 8 years, I don't know how long it's been since the Trauma-Informed Task Force was started. You know, Sheamekah was really careful, and Jackie, that all of the agencies were represented because trauma doesn't just belong, or the understanding of trauma doesn't just belong in your behavioral health agency. Every single agency and legislators and the governor, they all need to be informed. They need to understand social determinants of health. They need to understand how trauma is affecting our children and our families. And if every single person that works for an agency or an organization or a wraparound program across the state, if we're all consistently working with a trauma-informed lens, then what we know is our health disparities should start, you know, getting better just because we're all using that same lens.
Wonderful. Thank you so much, Joni. So guys, what I hope you're hearing here today, I know sometimes when we hear these model programs talk, we say, oh, but my state's nothing like that. There's no reason it can't be. These are real life people. And they've just worked really hard to make these partnerships and to cause this to happen. So as we're talking, please be thinking, not, oh, this can never happen in my state. Be thinking, I'm taking this home to my state and we're going to make some changes, because Oklahoma didn't just wake up one day looking like this. This is a lot of hard work we're hearing about here. I want to change the topic for just a minute, and let me ask you guys first. How many of you are familiar with 988? Are we all good on that? Okay, let's find out how Oklahoma's doing with that. How are things going, Sheamekah?
Well, I would have to say specific to children, youth, and families, and of course our adult system, things are going extremely well. I think that Oklahoma, again, prior to the 988 rollout, had a robust children's mobile response system.
Yes, you have.
That was already providing response services statewide. And I think so when 988 came to part and we began to branch out and begin to develop adult services, it was a really great fit. We worked together candidly in order to make sure that children, youth, and families who access our 988 line have a response personnel that understands the need. We believe that, again, families want a response and they want a response that's caring. Those are the two things that we know about the youth and family. So I would have to say, it's not just for us to develop a 988 crisis response. It's really for us to develop a full continuum of care of crisis services here in the state of Oklahoma. We look at avenues of intervention, prevention, you would probably say, in ways that we can identify populations across the state that are really maybe on the higher end of the spectrum as it relates to crisis services. We can look at a combination of our call data to identify hotspots in the local community, times of days of the year that crises are up. And so Oklahoma has a pretty robust system. We've included the idea of technology. I think people think I'm crazy when I talk about the technology infrastructure in a rural state like Oklahoma and the utilization of iPads in order to make sure our law enforcement officers are equipped when responding to a mental health distress, especially when safety is a factor. And so I think that we've expanded in ways. We have school-based partnerships across the state as intervention points. We are partnering now to reduce the number of families and young people who connect with our emergency rooms as a point of access. We're standing up family urgent cares across the state where families and youth can go within a 24-hour window period in order to receive access to emergency care services instead of utilizing emergency room for those services.
Sheamekah, stop there just a minute. I want to hear more about that. Family urgent cares?
Yes, you're probably familiar with the adult urgent care models. Well, adult urgent care models are designed to provide up to 24-hour psychiatric services in order to help an adult who is in a crisis emergency to kind of reduce their symptoms, to be monitored for about 24 hours if they need medications or other support services they can offer. Well, we've expanded that to include families and youth. So no longer will we have families that will take their young people to emergency rooms to seek out psychiatric care. We will have urgent cares across the state where families can go to a psychiatric urgent care and get their needs met. The idea of the design is really kind of follows it's out of Ohio, Nationwide Children's.
Yeah, that's my
Nationwide Children's Hospital allows parents to stay in the psychiatric environment with the kid. So the idea of our family emergency rooms is the same, where families will go in partnership with their young person, and they will stay with that young person from the time that they enter the door to the time that they're reverted back to a community level of care, receiving the support from a licensed mental health professional to help to work through and process through the crisis. And so there's no longer this concept where we take our kids to an acute type of setting and we walk away. The only environment where you can leave your kids is a jail detention center or psychiatric placement. So what we're trying to do is work with families and youth together in order to process through those crises, so that when these kids are returned back to the community, they have a caring adult who's able to help them to sustain that stability.
So both your family and your young person would receive
Yes.
care from this licensed person in the middle of a crisis. That's amazing. We want that everywhere.
Absolutely.
Has anyone in here utilized their 988 system? Has anyone had to call? I'd be interested in a personal response to that. I've talked to a few folks across the country who have used it, and it's been, differing levels of, it worked beautifully. I don't think I've heard one that's worked this well, and then people where it just didn't work quite as well as we want it to. But it sounds like you guys have really got it down to an awesome start.
Well, we're not perfect, but we strive. We see every call that comes through our line as a life or death situation. And we want to make sure that from the call level to the intervention, that we're there to support the family, the youth, in a way where we don't have scenarios where it is life or death.
And I would say I stay in a state of kind of awe when I look at our Department of Mental Health and Substance Abuse Services, because it's no accident that I just saw an article the other day where our 988's in the top 10 across the nation of success. And that is because nothing comes as a surprise to the department. This is built on layers and layers of a foundation that they have the insight and expertise to understand we need to be doing this now. So by the time the national folks decide to come around and do something, DMH is usually a few years ahead.
Yeah.
And they already had kind of a system in place where we layer 988 on top of an already successful system. And that's kudos. I will say, Sheamekah and I were at a conference in 2016 on children's mobile crisis. And she was like, I'm going to do this. And I was like, that's a 5-year project. It was implemented by the next year. I've never seen anything like it. But that's the Sheamekah and Commissioner Slanton Hodges and the leadership there are just phenomenal.
But one of the reasons they can do this is because they have data. It's incredible. I've watched Sheamekah present like at project directors meetings, and you can see the data. Why are people calling? Especially when we had the mobile crisis unit, you could see why did they call? How many of, almost all of them were diverted. I mean, it was in the 90+ percentile were, did not end up in a behavioral health hospital. And that's huge. And they've been able to build on what they did for the mobile crisis response to the 988. It's just been kind of a nice extension, hasn't it, Sheamekah?
Absolutely.
Just serve them even more.
That's what I was gonna say. They started talking to us about 988 a long time ago. And it like when that went national, I was already trained to say, then you can call 988 or you can use this resources. So they did a good job of making all of us aware of what was coming down. And then you just kind of go, by the time it happens, you're ready for it,
Yeah. It's I'm just really having reflections, because I remember in I think it was 2018 when we went. And I think that a group of us from the different child serving agencies went to a platform to learn about mobile response and stabilization, and to look at where we were then and where we were now, and also to look at how our system responded during one of the worst pandemics that we had across the nation. The one thing that I'm able to say, no matter where I go, is I feel like Oklahoma was in a position to respond. We had already thought about technology infrastructure across the state and how technology can be utilized for the purpose of providing direct treatment face-to-face. So those types of things that the healthcare authority, the department, in that partnership early on was, able to leverage those types of things. And so when I think about where our crisis system is, it's not perfect, but then also it's where I get the phone calls from Joni Bruce to say, hey, I got a family who has, her experience didn't quite go right. But the fact that she's able to make those types of calls for me, to give me that broader look at our system, and to really begin to move in and to make changes in order to make it better for families. So communication, collaboration, partnerships are critical when developing a system.
Well, I want to switch this up just a little bit. Sheamekah and Traylor, just to put you on just a
tiny little hot spot here. And then we'll see if we've got questions from the audience. So I'm going to ask Joni and Becky to think for just a second. You guys, you know how blessed you are to be in this system. I mean, it's amazing. Oklahoma is getting kudos every day for the work they're doing. I've known Sheamekah for years, and she is unwavering in her dedication to what she's doing. And Traylor, I wish we had you in every state as a Medicaid director. But I know it's not perfect yet. So Joni and Becky, I want you guys to think of something that you want to see happen for families. And then let's just do some problem solving. How are Sheamekah and Traylor going to make that happen? Maybe not tomorrow, but what's the plan for it?
I met with some of the folks a couple of weeks ago, and I said, why can't we have sober high schools?
Have what?
Why can't we have sober high schools where a kid that's struggling has
I
a
like
place where they go? And, you know, that started some thinking, and, you know, but there's one in Oklahoma now, here in Oklahoma City, but I don't know how many it has. Somebody may be here from there, but yeah, sober high schools. Can we do that? Can we make that happen? Can we do a pilot site? And nobody has said a crazy idea.
Sober high schools. What do you guys think?
I bring go straight to. I don't know if Medicaid can reimburse for that, but we could always get creative with managed care plans, hopefully.
I think that also the creativity, you know, when she's saying sober high schools, when I think about the creativity that our partner agencies like the Evolution Foundation, Oklahoma Federation, the Federation of Families, Parents Helping Parents, and the Oklahoma Family Network. When I think about the different partnerships that took part as a part of COVID, during COVID, our partner agencies partnered with public schools for the purpose of creating opportunities where young people can connect. When kids went back to school, they could not hug. When children went back to school, they couldn't hug, they could not touch.
Right.
Our partners were able to implement things such as calm rooms. Our partners were able to implement things such as therapy dog programs where kids can hug and touch on therapy dogs for the purpose of having that type of connection. Who would have thought that that type of out-of-the-box thinking could have had the tremendous impact that it had in some of our rural schools across the state? So I'm not thinking, you know, thinking about Medicaid reimbursement. Sometimes if you design out something based on the need and the desire to support a population for people, there's a mechanism for some type of reimbursement. So it may be sober schools who have mental health professionals embedded in school, providing co-occurring services and supports, and really leveraging those types of things. So I'm not opposed to the idea of how to develop something.
Now we understand why Sheamekah is where Sheamekah is. She can on the spot. And our Medicaid folks can say, we may not know how to do it right now, but we bet we can figure that out.
This is why we partner.
Joni, what about you? What would be a great thing to see happen?
I think to build on what Becky said, sober high schools, we need it at college too. There need to be
Yes,
sober living
absolutely.
dorms, you know, and that's going to bring in higher education and all that. I think that's important as well. I know they're doing that, some of the Texas colleges. So some of our kids are going to Texas to college instead of staying in Oklahoma. But I think the other thing that I would say that we've wanted for a long time in our state is a conference similar to this for families and youth, at least every other year. You know, we've had the privilege of attending the Children's Behavioral Health Conference, and that's been amazing. But to have a conference like this, that's just for youth and families. I know Sheamekah's wanted to do it for a long time.
Yes, she has.
And it's just it's a funding issue. We're excited to have the Federation Conference here, but I'd really love to see us have a family and youth conference in a couple of years. Just start trying to do fundraisers or write grants or whatever we need to do so that we can bring families together like this, because you know, just walking down the halls and seeing families from different states connecting, We've had a lot of people ask us to send them more information about things that we're doing, and we've done the same thing with others, and that's so meaningful.
Okay, let's see, does anyone have questions or comments? Anything that we can tell you from this panel that would help you as you go home? Any questions? Any?
Raise your hand and I'll come and get you.
Michelle's got the mic.
Hello. Great. Well, first of all, this has been fantastic to listen to what you're doing in Oklahoma, especially just getting to hear what you're doing for families. I'm so excited about, whenever families are receiving services that help them. Thank you so much. I have two questions for the two ladies in the middle. You were talking about high fidelity wraparound, and I'd like to know, the first question is, I'd like to know if you have a family support provider for every one of those families that are receiving high fidelity wraparound. And my second question is, how do you train and support those family support providers within wraparound?
Jerry, you want to answer that? No. Jerry Mullendor, our coordinator of family involvement. So in the state of Oklahoma, families that receive wraparound services have access to a family support provider. Okay. Our family support providers work hand in hand with our wraparound facilitators to support, advocate, and to coordinate services for families across the state of Oklahoma. So it's one of those things that it's really embedded in our wraparound model. The other thing is, I think that if there is ever anything that as a director of children's service, I would encourage other states to do, is to build their non-degree positions in a way where it supports the workforce. Workforce development is such a huge thing now. And I don't know if I'll get in trouble for saying this, but we can't build a mental health system on the backbones of licensed clinicians and PhD level staff. So I think that when I think about, I'm in a lot of platforms to talk about issues in workforce. So I'm not to say that we don't have any issues in the state of Oklahoma when it comes to workforce development. But the one thing that I feel like that we have done right is we have developed family support providers as a foundation, and I say a foundation to wraparound services in the state of Oklahoma. They are the driving force behind that work. Family support providers can have those peer-to-peer interventions that other staff have not been as successful with. And so it's a hand-in-hand thing here in the state. Wraparound doesn't happen without a family support.
And that took a good partnership between these two agencies, because you had to find a way to pay for the family support providers. And my understanding is not every state has been able to do that yet. So really working with your Medicaid agency and your Department of Mental Health and Substance Abuse Services will be important to be able to do that.
It's gotten to the point where it's very rare that a mental health service is not reimbursable for the sooner care in Oklahoma.
So Traylor, you're telling us that Oklahoma Medicaid will reimburse for family peer support?
We do reimburse for it.
They do reimburse, guys. If your state's not doing it, it can. Let's make that happen. Other questions?
Oh, okay. Yes, I'm sorry I didn't finish that up. But in the state of Oklahoma, we have an infrastructure. We have a coordinator of family involvement that is on our state team that provides leadership, guidance, and direction for the involvement and the inclusion of families here in the state of Oklahoma. We, the department, provide the training for our family support providers across the state. In addition to that, we have state coaches that actually go out coaching on high fidelity wraparound, so they have an opportunity to interact with our family support providers. We also have, I'm
may not say this right, but we have infinity calls where our lead family involvement coordinator works to provide skills building with families for providers across the state through a lunch and learn, a webinar, or some type of support network. And the one thing is at the department, because we are a technical assistance provider, we go out to our sites and do face-to-face coaching and support our providers that are providing those services.
And one thing I would just add to that before we go to the next question, Jerry, would you stand up for just a minute? If you guys want to know more about this and how Oklahoma's doing it, here's the woman you want to talk to. She will be, can I say you'll be happy to share, Jerry? Please talk to her. Jerry's amazing. Other questions?
Hi.
Mary?
Yes, hi, I'm Mary Viano from the Family Organization in Massachusetts. My question and comment is about line 988. So one of the complicated piece, I think, for families is Massachusetts has decided it's a suicide text line, a suicide support line, not mental health. So it's interesting for me to see that nationally, it came out as a line for behavioral health or mental health, but certain states are choosing the unique piece. So I just wondered if you had any feedback on that. And then the other question or thought I had was, we were just named a seat on the 988 commission, and there will be 5 people with lived experience, including youth voice, on that commission to give feedback. And I wonder if Oklahoma had thought of that, or other states as well, in including the family voice as this rollout starts.
This is a two-part question. Part of the first part I didn't get to.
So I will say, I met your Medicaid folks at a conference not too long ago, and they were talking about how they were rolling it out. And I asked the same question, why aren't you leveraging 988? Because MassHealth is utilizing their own kind of crisis, like you said, suicide line. And my understanding from them was there was a lot of governor initiatives and maybe legislative initiatives that were kind of piecemealing the approach, and they weren't going to leverage 988. So the question was around, why would a state choose not to do 988, maybe do their own?
I don't know the direct answer to that. I mean, what I've been doing is encouraging states to utilize this opportunity to partner together all the initiative to create one single access point, because it gets complicated when you have multiple access points to similar systems. And if states can work together in partnership to create a single access point for their state, and to utilize and leverage the fundings, to do some blended funding, to really look at ways that the different pockets of crisis care money can work together for the overall benefit of the state. The second part, I want to say you had a question around peer support or family support involvement in the 988 Advisory Commission.
Right, so you have your family and youth voice embedded in your either commission or connection about how it's working and not working, because we're finding families in our state, the mystery calls that we have going in are not supportive.
Okay.
They're not helping.
Right.
We've actually had some people that, court is mentioned within the first 30 seconds of the call.
Right.
That's not going to help people with mental health.
Absolutely. And so I think that there's multiple points of intersect for families and youth. I think that families and youth should definitely be on the professional advisory council or committee for the implementation of 988. I also think there are ways to get the voice. I think there are focus groups that can happen in diverse communities that are larger, metropolitan, urban, rural, however. But also I think that one of the most important things that we do here in Oklahoma is we have follow-up calls after every single crisis incident. And we want to know what that experience was about. And so what that does is it helps. Shout out to the University of Oklahoma, who facilitates our data collection on our crisis information. That helps us to see what are families saying. Was this service helpful? But not only what was it helpful or was it not, but at what level did the complications start with the call center? Did it happen at the provider level? Was the warm handoff not fast enough? So it allows us to evaluate our system to see where are we not getting to the immediate response and the caring response for our families in the state.
I'll just add to, one of the things that Sheamekah did, and you should give your children's departments or behavioral health directors this idea. She called the dadgum line to see what happened. And she would call in and she would give a scenario and see how they did. I mean, that's a pretty novel approach. We loved it.
Yeah, Joni's reminded me of the earlier days, and in the earlier days, again, it was really important for me to know what that experience was like. So I would do cold calls, different times of the day, days of the week, to get that experience for myself in our initial rollout. Yeah, I remember that.
Yeah, she also snuck into my live streams a few times. I said, oh, that's all right. Can I touch, before we totally away from wraparound? I just want to say, we are not a wraparound organization, but if Joni has a family, she knows she's going to call me and say, I have this person, and I've given them your information. We get so many opportunities with the state to talk to groups because they have so many different groups meeting. I can't count now on my hands how many times we have an opportunity to just get out there amongst state employees and others and say, this is what we do. This is how we do it. So, and that's just been great. So we get that exposure that way, and then they know, you know,
Right.
they need to call us when this is happening.
That is wonderful. We could probably do one more question if we've got one. If not, we can go ahead. All right, I do not see a question. If you've got a question, shout, because I can't see anyone else's hand up right now. And without that, we are right on time. So I want to say thank you, thank you, thank you, thank you. This has been amazing.